First of all, thank you, Stephanie and Healthie, for having me. My name's Steve Delacroce. I've been a dietitian for 15 years and had a private practice, and also become pretty savvy in the billing side, and actually have a company where we service dietitians. So just a little quick background about me. But first of all, I hope you're all safe and healthy, and your families as well. I've been sheltering at home for over a month. I'm out in New York. And so for some of you, you're seeing this in the morning, some of this is in the afternoon, but welcome everyone. Today, it's a bit of a mix of some basics. So for some of you, it might be a little too basic in certain parts, but we're going to spend a good amount of time as far as the billing piece and how to bill for telehealth services right now right in the middle of this COVID emergency. And we'll talk a little bit about what to expect in the future, although there's not a lot of answers for all of that. But I really do want to make sure things are simple, that we cover nuts and bolts of what to do, what to expect. I want to minimize denials, and I want to make sure you're getting paid 100% of what you should be for your service. So let's jump into it. First, we're going to cover just a couple of basic things. Again, how to make sure the file in your Healthie EMR is complete, because without that, things will be missing. And the reason I bring this up is some of you are using different platforms for billing. Maybe you have a biller and they communicate with you in a different way. So I want to show you how to use Healthie to its full capacity to make things easier and simpler and much more streamlined. I think you have to have a good process in place. Most of you are practitioners, you focus on what you do. You're not just focused on the billing piece. So you want to make it easier and streamlined for you. So that's what I'm going to cover some of that. And then we'll break it down into how to use that from accuracy in the billing piece and what a good bill should look like. And we'll talk about codes for telehealth and a lot of the changes in policies and everything going on there. And then how to submit that and correct it if need be, because that's happening right now with some people were submitting bills and not getting paid what they should have, or getting denied, and what to change, because frankly, there's a lot of confusion from the insurance companies and they're not helping. So hopefully my job today will be to clarify a few things, kind of clear the field, make things a little simple. I will say as a dietitian, and most of the billing that we do is all for dietitians. So that's going to be the focus of the talk. There are a few of you who may not be dietitians, but we'll try to make it general enough that applies to everyone, because a lot of the rules really will apply to everyone. So when we talk about codes, some of them will be specific for nutrition, but not so much on the telehealth side, just from the actual procedure code part. So let's move it into. So number one, let's start from the beginning, right? Again, if you're not using your EMR in its full capacity, you may not have set it up properly in the beginning. And the reason I bring this up is everything that you're putting into your profile or your settings will show up on a bill, right? Your organization's information. If you're a sole practitioner and you don't have a corporation, then it's just you, it's your individual MPI, and it might be a social security number, and you don't have a tax ID number. So that's fine. If you're an organization, you have a corporation, you've created a organizational MPI or a type 2 MPI, here's the thing, whatever the insurance company has on file, that's what you have to have on your bill. And that might be different from one insurance company to the other, depending on how you credentialed. So keep that in mind, all right? I mean, my recommendation is keep everything streamlined, keep everything organized, do it all the same, credential yourself with every insurance company the same way, same tax ID, same MPI numbers, same address. This way it cuts confusion, because every change and everything that you submit, if it's anything off by a digit, if it's off from what the insurance company has on file, it will get rejected. And I want you to avoid that. So again, go through in your settings area, make sure your practice is set up and your organization set up properly, because again, that will show up on a bill. And make sure your individual providers, especially if you have more than one provider, make sure that individual MPI is different if that's what applies. So again, start from the beginning, keep it simple. And then we'll go into your patients, all right? So assuming all your information about you is correct, let's talk about your patients. I find that a lot of dietitians, or even if you have staff who are doing your scheduling, may not be putting all the information into the patient's chart correctly or completely. I think completely is probably the better word. It's not that you're intentionally leaving things out. It's just simple mistakes. So after we go through what we just talked about from your organization, now again, we're talking about your patient's file, your client info. So this is what your screen would look like in Healthie. We're in the Actions tab to your right, and then that's where everything is broken down. You want to go through these one by one. So I'm going to just show you a list of everything that needs to be complete for any bill, telehealth or not. But if you don't spend a minute to go through this when you have a new patient, or if you're billing for the first time on an existing patient, because again, maybe you're using another service to submit your bills or a biller, if you don't go through this real quickly before you submit that new bill, then you're going to be missing some information. It's very easy to miss. So the key things to make sure are complete in that Actions tab, correct spelling of the patient's name, so if the patient goes by Steve, but is really Steven as far as what the insurance company has, because that's all that matters, make sure it's correct. All right, should have the full name, date of birth, and gender. It's easy to miss a box here and there when you're filling in demographics. Address has to be correct, and it has to be in there. You cannot submit a bill without an address. And then, of course, the insurance piece, right? Once you go through the insurance, there's some things that could throw you off. So first of all, are they the primary insured, or what's their relationship with the insured? Is it a spouse or a parent? Make sure their information's in there, their name and date of birth as well. And then I think where a lot of people get confused is which insurance company do I choose? Because some of them are easy, like United Healthcare. There's one United Healthcare. It's 87726 is their payer ID, and I'm talking about that 5-digit payer ID that's listed here. That has to be on the bill. I'll show you where it goes later. But we want to choose the right insurance. So it gets confusing with Blue Cross because there's a lot of Blue Cross plans. So whatever your local Blue Cross is, make sure you're choosing that plan, that 5-digit payer ID. If you're submitting to Medicare, there's state Medicare. So you want to make sure it's the correct one. In fact, in some states, there's a northern and a southern, and a couple of different Medicares depending on where you live, or again, how you credentialed. So just make sure you know what the 5-digit ID is. If you're not sure, it can be on a patient's insurance card sometimes. It may say it there. But again, usually there's only a handful of insurance plans that you're billing. Typically the common commercial plans and your Medicare and Medicaid, so it should be repetitive. But again, if it's not on the insurance card, you might want to just check with who you credentialed with, because that's, again, the most important thing, all right? So make sure after you choose the insurance company that you look down on the address line. That's going to be when we look into a patient's chart. The address line should be the 5-digit payer ID, not the mailing address. We're not doing anything mailing. We're doing electronic here. So everything's got to reflect the proper ID number, the payer ID number. So make sure that's in the right place. Of course, member ID number has to be right. Sometimes there's suffixes and prefixes that can change depending on if they're a spouse or not. So just, again, accuracy is important. I really recommend at some point getting a copy of the insurance card. And I know it's challenging because you might not be in the office with the patient like you used to be, but get them to scan it into their Healthie account, put it into their chart, right, where your documents are, and get them to fax it, anything that they can do to get your copy of it. Because if you get a denial and the number's wrong, I mean, it's very easy for somebody to type in the wrong ID number. It's just easy for it to happen. So you want to have a copy of the card so you know it's accurate. And again, the payer ID may be on there. Also, if they have a referring physician, especially if it's Medicare, Medicaid, or an HMO plan, you make sure that referring physician's on there. I'll take a look at that because I think that's a place where a lot of times mistakes happen. And then to make your life easier, if you're not doing this already, in the Actions tab, going back here on the bottom is diagnoses. So if you know what the diagnosis is already before you see them, put it in there because it'll populate on the bill automatically. You don't have to retype it. So just to summarize, you want to go through this section in the patient's chart so that every time you create a bill, it's a couple of clicks of the button, and it's literally seconds to get that bill completed. All this stuff is pre-populated to save you time and erase errors. You're not retyping the referring physician and the patient's address and the diagnosis every single time. This is Healthie makes your life easy. So use it to that benefit, okay? So as far as accuracy in the bill, now let's say you got the patient's chart in, now you're going to see the patient. Now we're looking in the patient's file and we're going to the billing section. So you're going to click on billing, and then we're going to click on the CMS 1500s. I know a lot of times we go there assuming it's the first tab, but you may be in payments. So make sure you're clicking on CMS 1500, and then you're clicking on new CMS 1500. That new CMS 1500 is going to draw in all that information from that last screen we looked at, the actions tab. It's going to bring it all in. And now we just have to make sure everything's correct as how we put it in, and then make a couple of choices based on the service you've just given. So let's go through that. So again, assuming the client information is correct. Now again, I'll show you where to check off if the referring information needs to be included. So does the patient have Medicare? Do they have Medicaid, even a managed Medicaid plan? And do they have an HMO? If there's at any point they need a referral, you need to check it off. If they don't need a referral, you do not have to include it, although there's no downside to including it. You know, a lot of you get referrals from doctors, and that's how you meet your patients, but they might have a plan where it's not required to show the referral. But again, it doesn't hurt if you just include it there, okay? So again, accuracy. You want to make sure your referring provider also has their MPI number. That's something that gets missed a lot. Again, I'll show you what that looks like. So I might come back and forth a little bit here between slides. Follow me here. We will talk about service facility, the location code highlighted here. The reason I highlighted it is because that might affect the telehealth, right? That's where we start being a little bit more specific. But again, everything else here just needs to be correct from the actions tab. So, you know, opening up the client's file, this is a new bill, client information. Again, this should all just be right. Make sure it's all filled in. Anything that's blacked out here, what's filled in with patient info, including the gender. So make sure that's there, nothing missing. The next section that's going to come up is this referral information. So where I highlighted, these are the places that I find most people forget to check off. It's a little bit hidden. So, you know, if you're going to include a referral, you're going to click that first highlighted area on the top there. If you don't click it, it's not going to show up on the bill, okay? The rest of this you leave blank until you get to the bottom. Now you need first name, last name, and you need the qualifier. If you don't know what a qualifier is, that's signaling to the insurance company what that doctor's role was in this. So usually it's referring provider, and that's a D as in David, N as in Nancy, DN. Okay, there are supervising providers if you're doing some primary care settings, maybe intensive behavioral therapy. The doctor needs to be on the same facility as you, so supervising might be one that you choose. But for the most part, you're using referring provider there, and then has to have their MPI number. If you don't know where to look for someone's MPI, it's the same website where you got your MPI, that NPPES system for CMS. You could search any provider in the entire country in the US, you will find their MPI number. So if you don't know it, it should be there. It's probably on the referral. It's probably on a script that they gave you. It's almost always included. And of course, your office could, call the medical office and get that from them. But do not leave it out. It will get rejected. All right. So again, maybe you don't need this. Maybe all your patients are commercial pay and they don't have any referral requirements. So fine, move on. Okay, now you get into your service facility. If you have not set this up in your organization information, then there may be some wrong information here. But you could also create it in your in the bill itself, and it will kind of replicate itself every time you make another bill for another patient. So follow me for a second because I'm going to talk in generalities, and then we're going to talk telehealth. All right, just not to get confused. So again, make sure your facility name, your address. This is the address that's on file with the insurance company. Remember I said everything you tell the insurance company when you credential them is what you have to give them on the bill. So let me answer the question right away. This is what comes up right now with telehealth. Okay, I usually work in one office. I usually see my patients there. Sometimes I even provide telehealth there. That's approved as an office to be billed through the insurance. Now I'm seeing the patient from home. Do I change this to my home address? And the only way to answer that is, well, is your home address approved for you to see patients? If not, then no. Leave it as your approved service facility. Whatever office you have on record with that insurance company, that's what you're using here. That's the service facility. This is where you're providing the service for. And I know in the beginning, they made it seem like you should just put in, whatever information is from wherever you were providing the service. most, if not all, insurance companies have realized that they don't want to change anything during an emergency state, which we're in. Whatever you would normally do before this emergency, that's the information you want to give them here in general. Okay, so looking at this large box here, just for a second, hold off on those 2 place of service boxes showing up on the slide. Just here, just make sure your NPI numbers, what they have in file as your organization NPI, your address is what they have, and then you choose the place of service. All right, I'll also show you what this looks like on an actual CMS 1500 form, the claim form that's going to go to the insurance company. So typically in your normal office face-to-face setting, you would choose 11 for your office. That's the location code. That's the place of service location code. So most cases you're going to choose that. Now, you have the option in some cases of doing a home visit, right? You're going to the patient's house, like Medicare approves that. So you could choose 12 for location, place of service. But right now with telehealth, some insurance companies are giving direction to choose 02 telehealth. So you see that up on your right as one of the options. Okay, so here's what I'm going to come back and forth to this piece as well. I kind of expected the insurance companies to backtrack a little bit on the direction, especially Medicare. You know, everything in insurance follows whatever Medicare says typically. And then insurance companies can choose what they want to do, right? It's like the government says what to do, and then the states can choose what they want. Insurance companies could choose to give you direction. What most of them have come back and said, and most recently was Cigna at the time of this recording, was do things how you did it before the emergency. So no, you don't have to put O2 for telehealth if you're providing a normal face-to-face service. We'll talk about modifiers in a minute, so don't get confused. This is location code. So in most cases, you can put 11. The reason why you may want to, even if insurance companies put out guidance with 2, to put 2 as their location, is in some cases that actually reduces your reimbursement. And you're not lying to the insurance company by saying that you provide the service in your office, because you did. It might be a home office, as long as secure Wi-Fi and HIPAA is all being recognized and performed. And I think that's the right way to go about it. I don't care what the government says. Try to follow HIPAA rules, right? But you're not lying to the insurance company by providing telehealth with the use of the 11 office location code. And I'll show you why. That has to do with the modifier. We'll come back to that. But in some cases, the insurance companies are paying 100% reimbursement rate with 2. And if that's the case, great. Use 2. I wish I had the answer of everyone. Frankly, our company calls dozens of insurance companies a day, and we ask what their direction is. And frankly, it's not clear to them either. They're being, every rep you talk to is being given different information. It's not being disseminated quickly. So it's confusing. So what I recommend in general is give the insurance company what they need, give them what they want to see, so that you don't get a denial. They don't want to handle a lot of denials and resubmissions of bills right now. They have a lot of other things that they're dealing with. And the other piece is that location code of 2 was really geared towards a lot of medical practices, not so much the nutrition and maybe physical therapy, occupational therapy, like those areas. They really were focused on the medical field, right? I mean, that's just their priority right now. It's an emergency state. So again, if you're conducting typical normal service in your office, even if it's via computer, your office code is usually fine. I've seen some insurance companies who said to use 2 as their code. I've seen them reimbursed for 11 just the same way, as if we weren't in an emergency state. So I think that's basically the path that they're following. Again, we're at the middle end of April of 2020 right now. I think you're going to see other insurance companies follow suit as well. That's my prediction. But there's very little downside. And the reason there's very little downside, other than delaying the payment, is because we could always submit a corrected claim. And we'll go over that in a minute. Okay, so again, this is all about setting up the bill correctly. Make sure this is all accurate. Most times, and I mean most times, you're going to choose 11 as your office, and that's your location code. Now, once we get into the billing item, which is where we put the date of service, we put the procedure code, we put how many units and how long we saw them and your charges. That, of course, has to be the same as always. And the reason why the modifiers aren't too complicated is, especially for most of you being dietitians, we use a couple of procedure codes, right? A procedure code or CPT code is the one you see in the middle, the 97803, which is a follow-up visit for medical nutrition therapy, right? 97802 is initial, 04 is group, so on. Some of you use some diabetes G codes. Whatever you're providing is the same service that you were providing even not in the emergency, right? It's not a COVID related service. And I think where a lot of insurance companies and the government included Medicare confused people was they started bringing out these other G codes, like, oh, use this telehealth G code or this telehealth procedure code. Well, you're not really doing telehealth. You're providing medical nutrition therapy, right? You're providing whatever your normal service is. So put that code in. That's what you're telling them what you didn't change because of COVID. It just changed the delivery of that service. That's it. So that's where the modifier comes in. If your delivery has changed, then you're using a modifier just to be, nice to the insurance company and let them know what you did, right? And that's where, if you see here, there's two modifiers, right? We have modifier 95. This modifier is almost identical in description to modifier GT. Okay. The reason why I put 95 in here, because it matches with 97803 and 2 and all the MNT codes. 2018, they approved 95 to be coincided with the MNT codes that we use normally. All right. So you're going to be approved to provide your service in your office doing MNT through a telehealth service similar to what you have with Healthie, because it's video, it's live, it's interactive. That's what 95 is saying. Okay, that's telling the insurance company you did a live interactive face-to-face encounter. GT is almost identical. All right, it's just a little bit more broad, and it kind of covers some other medical field, or frankly, it's more for the medical field. So it's not that it's inappropriate, but it is a little bit different, just enough that it might affect your reimbursement. And that's what I'm worried about. I don't want you to get paid 8 to 10% less, which is what we're seeing, by using the wrong modifier. It's not fair to you. Now, not to confuse you more, but GT is typically paired with the O2 telehealth place of service, right? That's the code that some of insurance companies are saying. They're saying use O2 and then use GT as your modifier. And again, if that's their rules, as long as they're paying you 100% for your time, then maybe that's the way to go. That's fine. So we'll talk about, where to look for that information and maybe what the next steps to do if you do need to make a change. But I'm telling you, from what we're seeing, is 90% of the time using your typical CPT code with your office location and your modifier 95 is being processed quickly and being paid at 100% of what you would have gotten prior to COVID. Use the other codes as needed. Okay, that's the recommendation here. We'll talk about a couple of other modifiers because you've seen some codes come out, and that is frankly just confusing people. But I'm all about keeping it simple, because the insurance companies, contrary to what a lot of people think, there's no one sitting there with a fine-tooth comb going through every bill. It's all computerized. No one's being paid a lot of money to sit there and identify problems with their bills. They're just not. So make it simple, make it go through, don't make it complicated. I promise you'll save a lot of headache if you can keep it simple. So getting back to a little bit more of a general term, again, I apologize to anyone who's not a dietitian. I just happen to have some codes ready. If you're not sure what diagnosis codes you're using in your practice, if you're new to billing, go to icd10data.com. That's a great place to find any code. You could search it by name or by the actual code. So the ICD column that you're seeing here on the left, that's just some examples of the typical nutrition codes. You have your weight related codes, the E codes, and then you have your 11 and 10 codes that are for the diabetes, the Z713. I know a lot of people ask about that. Is it preventative? We'll talk about that in a sec. Your kidney related codes, the N codes there. And then there's some BMI codes. These are all, the BMI codes are within our scope of practice to choose which ones are appropriate. And of course, anything that's medical, like a diabetes code or a kidney code, that has to be decided by a medical doctor and already on file. So just a quick side note, if you don't always need a referral, almost never do you need a referral for nutrition, But if you're going to use a diagnosis code, just get a copy of the patient's chart or a chart note from the doctor. Different than a referral. It's just a note. But that note will tell you which diagnosis codes they've diagnosed the patient with, and that's approved for you to use as one of the codes in your bill, right? That just has to do related to the MNT work that you're doing. Now, an ICD diagnosis code is different than a CPT code, which is a procedure code. That, again, is that procedure of the service that you provided. So I listed a few common ones. We talked about the 9-7 codes, the G codes being some self-management of diabetes, and some other codes that are nutrition related that some insurance companies will pay for, others will not. So like the S9470 confuses everyone. Blue Cross tends to pay for that code. Not always. Honestly, there's so many Blue Cross plans. And 99404 is an hour-long nutrition visit that I've seen paid for by Cigna in some cases to get some extra visits. But again, it's not to get too complex, but it's related to our taxonomy code. When you print your MPI, you chose a taxonomy that was assigned to you, and it's either approved or it's not. So keep things simple. Use the codes that you know you're going to get paid the most for the most visits. Just go with that. And it is different insurance company to insurance company, so I can't get too specific on this particular presentation. Now, the first code that you put in on a claim, and I'll show you what I'm talking about as far as location. The first code is the primary code. So you could put 4 diagnosis codes, but the insurance company is going to look mostly at the first one. The first one is either going to be considered preventative or medical, and that may affect a deductible or copay. In some cases, some insurance companies do not base preventative or medical on diagnosis. They decide on CPT code. That's why a lot of you get unlimited visits for nutrition, as many, for whatever diagnosis code you put in, because it's based on your MNT CPT code. That's just specific to the insurance company. So, if you're able to call and verify benefits prior to the visit, you may ask which codes are preventative and medical because it affects the patient's outlay of cost, right? So you want to ask, is this diagnosis code with this match of the CPT code? Are these two preventative? So, I'm going to see this patient for weight loss. I'm going to use E66.9 with 97802. Is that preventative or is that medical? And then the rep should be able to tell you if it is or isn't. Just make sure you get a reference number. That's the most important thing on one of those calls. All right, so choose your codes. You're seeing your patient. You're putting your diagnosis in. It should be in the action already of the action section. Put that in there. Go ahead. At this point, you're completing your bill. You're hitting to create that claim, and don't worry about how the CMS form is. But whenever I say CMS form, CMS 1500 form, the claim form, your bill, this is what I'm talking about, right? So it should be laid out the right way. You don't need to fill this in manually, right? That's what your EMR is for. That's doing the job for you. You just want to make sure there's no omissions. You didn't leave anything out, and you want the insurance company to get what they're expecting to see, which is their, the proper code for their payer ID, that 5-digit code, the right number, the right name, the right codes for diagnosis, for procedure, the modifiers, etc. And especially on the bottom here, this is that organization information: your location, service facility, your tax ID or social, and that billing address, which just might be your office. It typically is. Okay, so just make sure it's complete so that we don't get any omissions. That's the key. All right, so let's dig a little bit deeper into the telehealth piece of this. And this is what Cigna literally just posted about a week ago. And this replicated what Medicare said just prior to that. And I'm starting to see it from some other insurance companies. And that's basically that virtual care guidelines are supposed to just look like it, whatever it would have been at a normal face-to-face visit prior to COVID. That's what this is saying, okay? Now, they're giving some direction here with some codes, right? Some face-to-face codes that are the location, right? And they're amending that with a modifier. So just telling you a little bit more information. They put out this GQ code, which was basically just for some short phone calls. GQ is different than GT in that it's GT. and that it's not live. It's asynchronous. So it is maybe a text message which you're sending, and then there's a delay in the patient seeing it, or it's an email, right? Hopefully you're using HIPAA compliant platforms to do all that. But if it's not literally the same time and being able to see it, that's what GQ is saying. So if you're doing everything by recording, texting, emailing, anything like that, then put GQ. But most of the time you're doing something live, interactive, synchronous, which means at the same exact time. And that's where GT and 95 are basically interchangeable. And this is, I didn't type this. This is literally right from the insurance company. See how it says GT or 95? Because it's almost always the same thing. But I will say 95 was specifically approved for our procedure codes. And that's why I prefer it. And I think they prefer it as well. But look what it says about delivered face-to-face. The place of service that would typically be billed if the service was delivered face-to-face. Place of service 11. That's what we talked about before, okay? That is where you're doing your service, where you're giving your service, you're performing your business. It's in your office. Even if technically it's your home office at the moment, they're letting that go. That's not a restriction, okay? And they're even saying we should be reimbursing you consistent with what a typical face-to-face rate would have been. So act accordingly. That's all I can tell you is they're making it easier for us, thank goodness, because they just complicated things in the beginning. They weren't ready for this. And I think this is the most logical way to go. It's not our fault that we're working from home. We're providing as much telehealth as we can. And they're even loosening things up with telephone and using phone calls instead. So that's not preferred, but I basically, for the most part, they're saying even if you do something by telephone, it's still live and synchronous. So you might want to just bill it as a normal face-to-face visit. Just don't complicate things. It's not worth the headache. A couple of other a couple of things with this Cigna release, again, was similar to Medicare. Bill it as an office visit, usual codes that you would use for face-to-face. Normal cost share will apply, and that means the patient may have a copay if they normally would have had a copay. In the beginning, there was some talk about them waiving copays. That really was for the emergency services when a doctor was calling a patient or an office was calling a patient. Hey, I know you're sick with COVID, you're at home, are you okay? We're not going to bill you for a copay for that. That's really what they meant by that. Again, they weren't really considering our services at that point. So you may see copays still apply in this case. And you may see it waived. That's really dependent on the insurance company. And I think that's going to continue to change. But everything else should be the same as if it wasn't an emergency. Just bill it normally. And you should get paid normally. All right. So that's the next point is if you see that you're getting paid less, don't settle for it. Okay. I'm sorry, before I go ahead, I apologize. This is some more description of the modifiers just for your information. I think a lot of us get hung up on specifics, and it's just not worth it. But whereas we had a CPT modifier like our what's it called, place of service, right? Well, that was specific for a CPT. There are some diagnosis modifiers too. So anyway, these are a couple of ones I put in GA because some of you see Medicare patients who may not get approved for their Medicare to pay for it because it's not diabetes or CKD related, or maybe they've gone through that 2 or 3 hours that it's allowed. You want to use GA as a modifier so that it signals to the insurance company to go ahead and bill a secondary plan. That's what it is, okay? That's what GA is. And then GQ and GT, as I discussed before, one is not synchronous and live, the other is interactive and live, and that's the difference, all right? Not much more complicated. And then CPT modifiers, again, related to our MNT CPTs, there's preventative, which is a very popular one, so I included it, not to do with telehealth. 33 could be a modifier you decide to use because you want to say that it was a preventative visit. Frankly, it might not be up to you to decide that because, as I said before, insurance company policy will decide, is it based on diagnosis or is it based on procedure code? Some insurance companies do require this code. I want you to be familiar with it. It definitely doesn't hurt to use it really anytime. But the 95 modifier is specific to your CPT code. And that's the difference, right? You're telling them the same information, but they're seeing it in a way that makes more sense. The CPT 97802 and 3 is going to be approved for a 95 modifier. And I think that's why that's being paid 100% typically and not having a lot of problems. And I think it's the way to go. So just wanted to bring those to your attention. All right. So again, sorry, circling back around, what happens if you don't get paid, or you don't get paid at all, or you get paid less? Now, what do you do? Now you might want to resubmit that claim as corrected so that they can adjust your payment. It's really not too complicated. We'll talk about how to do it in Healthie, and then we'll talk about what it looks like on the actual bill itself. If you're using a clearinghouse, a lot of you use Office Ally, right? There's that easy relationship with Healthie and Office Ally. You can make this change there too. So I'll take you through it. But you have to have an explanation of benefits in order to do that. So whether you get electronic remittance advice, the ERA, whether it's in the insurance company portals like your Healthie and your Optum and those types of portals, or if you're getting it in Office Ally, or if you got a paper EOB. On that paper, we'll have certain things. So first of all, you want to update your records and make sure that you're tracking all your bills, and that's just going back to your system. And Healthie has the status that you could update to reimburse, and you can put the payment information. If it's linked to Office Ally, that might happen automatically, which is a beautiful thing. If it's denied or not paid the way you want it to, what do? Now you have to correct it. So now you have to add a resubmission code, which is 7. Okay, so now we're going back into our bill. We're changing the submission code. I'll show you what that looks like in a sec. So just familiarizing yourself. But on the EOB, you have to get the claim number. That might be there's a lot of different names that insurance companies use just to make things more confusing. They wouldn't be consistent with the term that they're going to use for a claim, right? But it might be a claim ID number. It might be a payer control number. It might be anything that you could tell is only for that one data service, one patient, one bill. And it's usually long. It's like 16 digits or sometimes longer. Sometimes there's numbers. Sometimes there's numbers and letters. You'll see it on the bill, right? It's not the patient member ID number. It's not your MPI number. It's specific to that claim, okay? So you're going to find that. And then you can come back to Healthie. You're going to make a new claim, and it's going to be a corrected claim. You do everything else the same, okay? You're going to update your code. Maybe you put 2 with GT and you got paid less. Maybe you want to change it now to 11 with 95. You're going to choose the resubmission code. So what we have here is we have the top 6 boxes here are your first claim. I had nothing in there in the miscellaneous area. The bottom 6 here, this is your new corrected claim. You're going to choose from your drop-down 7. That's a replacement, right? You're changing it. And here's an example of a reference number, that claim ID number, payer control number, whatever it is. You're choosing that. You're copying and pasting it, or you're typing it in here. You cannot leave it blank. That will show up on the new bill and tell the insurance company, hey, I changed some things. Please go back and look at it and make that correction, right? In some cases, it's, you put the wrong diagnosis, you put the wrong patient information and got rejected. Whatever the case is, you could use this process for any corrected claim. Now, Medicare does not accept corrected claims. You have to just submit a new one. So just make your changes and just submit a new one. But every other insurance company will allow you to do this. And again, you can do it here in Healthie. Send it over either to Office Ally or to whatever platform you have to, and then go on and wait and track it, right? Make sure you're following what's happening. So now we have our piece of the CMS form, and this, I just want to show you where everything goes. So, we're looking at these lines here, like 21 is where your diagnosis code, but 22 is where the 7 will go, and the reference number will be right next to it. It doesn't even have a separate box number. So you have to make sure you don't miss that. If you're doing this in a portal like Office Ally, and you can do a corrected claim, you click the little pencil mark, and you go into your inventory, you bring up the bill, you click on a little pencil mark. By the way, I have some videos on YouTube on how to do this, so I'll give you the address later just to walk you through it step by step. But let's say you're in a Healthie and you can bring up the bill and resubmit it. You just want to make sure you're putting this in, okay? So, let's say we billed 02 with the GT modifier. I came back and I want to change it to 11. All right, so I made my change. I changed my place of service. And let's say this was before I was home. I was still in my office and I didn't need a modifier because it was in face-to-face in my office. Great. go ahead and change the code, resubmission, put what I have to put in and submit it. There's a million different ways to slice this, different examples of this, whatever applies to your particular situation in your bill. Just make sure it's accurate when you resubmit it. And then you'd be surprised, especially since we're doing things electronically, you may see it get paid, corrected it within a week. It might be relatively quickly, depending on the insurance company you're dealing with. But don't settle for a low payment, and don't settle for denial. Don't get confused and lost. Use these tools. They're all in your EMR for you, ready to go. And then, at that point, it's up to you to track it, and please have a system in place, so if you're tracking something, I put an example of a simple spreadsheet, columns you might want to use, and create a spreadsheet or a Google sheet to track everything with. But in Healthie, all the bills that you submitted will be in a sent status, right? You can see that easily. If 4 weeks have gone by and you haven't gotten paid, that's something to either call the insurance company on or go into that portal and see what's going on. Why isn't it paid? What's going on? Don't let the insurance company drop the ball. They're inundated right now. Things could happen, so don't leave it on them. Again, you should be paid within like a week or two, especially since we're doing things electronically. But 4 weeks is a good time to let them catch up, if you will. If you're resubmitting something, the clock starts right then and there. If you're resubmitting a corrected claim, the clock starts. Right? If it took you 2 weeks to get paid the first time, it's going to take you 2 weeks to get that corrected claim. But track everything you're doing. Have this system. Set up your EMR. Put your patient information in right. Create the bill correct and accurately. Track your bills. Update your payment. Use this sent and reimbursed statuses to keep your accounting up to date, right? You should be checking all your bills, make sure everything's got paid, how much have you gotten paid, and use that for your accounting so that you can do your taxes at the end of the year. All these things are there for you to make your life easier. And trust me, I know a lot of us don't love this, like numbers and money. Like we just want to see our patients, right? That's why a system really makes a big difference. Just have it in place, keep it simple. Don't let yourself get discouraged or upset. It doesn't have to be that hard. Keep it simple, all right? And then now if you have a system in place and it's all getting done, you're getting paid and 100% reimbursement, what are you going to do with all that time and money, right? Hopefully you use that extra time to see more patients. I know it's a tough time, a lot of downturn right now, a lot of practices struggling. Definitely hearing positive from dietitians who are taking this time to kind of focus on their marketing, like how we're going to get people back in the door and be 100%, hit the ground running once the restrictions are lifted, or maybe get some patients who didn't want to do telehealth to come on board. Like, hey, it's really pretty good. Let me show you how this works. Or maybe you're creating a course, or maybe you're writing a book, or you're doing some videos. Do whatever you can. Now that you don't have to worry about your billing so much, you have some more free time to do that. And trust me, I know what it's like to be home. My kids, thank God, have been quiet this whole time. I don't know how, but it's not easy. So you have to do whatever you can to give yourself some time back. It's really important. All right. So I went through some of that really fast. I know there's going to be a recording of this. Please, check for notes. I'll do some Q&A here. If you have any questions about, me or our services, that's our email address. But also look up Nutrition Practice Management on YouTube, Nutrition Practice Management. And there's a channel there with some videos on corrected claims and submitting your claims in Office Ally and fixing them in Office Ally. That's all there for free, quick videos that will definitely make sense to you once you use them. Okay. So again, really thank you to Stephanie and Healthie for having me. And I know we have a bunch of questions coming in, so we'll spend a couple minutes and answer those for you.